an open bite and we decide that the patient needs some anterior pure extrusion, we have to plan very carefully how to stage it. In cases in which we have a class 3 component, like in this one, it is important that we plan the pure extrusion only when there is overjet. Imagine that in a case like this, in which we have almost an edge-to-edge bite at the very beginning, there is planned extrusion from the initial situation. This is something that it is not going to happen because every time the patient removes the aligners, the occlusion itself will avoid this movement to happen. Therefore, we have to ask the CAD designer to make sure that the anterior extrusion is only planned when there is enough overjet. So take a look, we're doing the distalization, we're still waiting for the extrusion to happen, and it is important for the clinician to decide. As you can see, the extrusion is going to happen on aligner number 44, and for this, we have to check an overjet view to check if there is enough overjet. If there is not at least 1 millimeter, and it might be reduced by, for example, some posterior expansion, we might ask the CAD designer to do it later. In this case, since we will be using class 3 elastics to help with the lower distalization, we can expect some proclination and increased overjet from the initial situation. So the staging is carefully planned, but what we can do in a case like this is ask the CAD designer only to bond the attachments for anterior extrusion, starting on aligner number 45. This way, the patient will start the treatment with these anesthetic attachments on the anterior segment, and they will only be used whenever they are really needed, when we have to plan the pure extrusion. This is something we have to tell the CAD designer and check ourselves. Please plan extrusion attachments on 12 to 22 on aligner 45. This way, we will improve the aesthetic impact of the smile in the patient, even achieving a perfect result. This is how we apply common sense to aligner biomechanics.